I'm Fiona, the physio from pelvicfloorexercise.com.au, and today we're going to look at how to set up and use your TENS machine. The TENS machine comes with two leads, and you should click these into your machine using the firm part of the lead, and when you remove it as well, not pulling on the actual lead itself. So we've clicked one into either side, and then we're going to attach our electrodes. So these come the self-adhesive electrodes. We leave them on the backing as you click these into place. Again, make sure you're using the firm part of the each end to click in. Don't pull on the delicate lead wires. So normally, quite often we'll use 4 electrodes. If you're only using one channel, you'll only need to use one set of electrodes. And for purposes of demonstration, that's what I'm going to do. So I'm going to remove one of these, and we're just going to work with these, this one channel. So to demonstrate how to remove them, you just gently peel the electrode off and then place it onto clean skin. If the area you're using has a lot of hair on it, you may actually need to shave the area. Commonly with pelvic floor conditions, we might actually use 2 channels and place the 2 electrodes around the ankle, because we're trying to get the tibial nerve when we're looking at treating an overactive bladder. If we're using 2 channels, we might be using it across the sacrum when we're doing a similar treatment, or we might be using it for pain, and quite often we'll use the 2 channels for pain as well. So you should speak to your treating health professional to get advice as to where to place your electrodes and how many of the channels to use. So just so that you can see, obviously this is not my pelvic floor, but we're going to, just so that you can actually see what's happening here. I'm going to turn my machine on now with the on-off switch, and we're going to scroll through. There are actually 11 programs with the TENS machine, and then there's 3 custom programs. So all you need to do is scroll through until you come to the program that your health professional has suggested that you use. Always make sure that you use the plus and minus side on the same side as the lead is plugged into. So for example, I can start to feel the tingling, but if you watch my fingers, as it gets higher, my fingers are starting to curl. So that's way too, I don't want contraction. So I would then bring that intensity down until I just feel a comfortable level there. If I was to change to another program, okay, with a lower hertz, for example, this is one that we would tend to use for overactive bladder. As I take it up, because the hertz are lower, it'll be a lot more like little tapping, which I'm feeling now. But if you watch my fingers, see my fingers are starting to twitch. That's way too high for that program, so I would bring that back till I can feel the twitching, but it's not making my fingers twitch. Again, just be guided by the health professional who's treating you as to which might be the most appropriate program for you, and also the most appropriate placement of the electrodes. Most of these programs, the preset programs, go for 4 hours. That doesn't mean that you need to use it for 4 hours. You could use it for as long as you like. Then when you've had enough, you just turn it back down, turn your machine off, and then you remove the electrodes. Remembering, when you remove them, please do not pull them by these leads. You'll damage the leads and the electrodes won't work. Gently peel the side up, gently peel it off, and then replace it back onto the plastic backing. These can be stored in the fridge to increase their lifespan. If you find that the electrode surface is starting to go a bit pitted and it's not sticking as well, you can just place a little drop of water on there, rub it in, and then just let it air dry, and some of the stickiness will return. If you find that your electrode just won't stick anymore, or the sides won't stick, it's actually telling you it's time to replace the electrodes. But you should get a good couple of months out of them. Thank you for watching. If you have any further questions, please don't hesitate to contact us on email info@pelvicfloorexercise.com.au.